Kienbock disease is a problem where a small bone in the wrist called the lunate starts to die because it does not get enough blood. Imagine a tiny brick in a wall that suddenly loses the water needed to stay strong. It begins to crumble. This makes the wrist painful and weak. The main cause is poor blood flow to the lunate. This can happen if the tiny blood vessels are damaged by a wrist injury, repeated stress like playing tennis or typing a lot, or an unusual shape of the wrist bones that squeezes the vessels. Think of a garden hose bent too tightly. Water cannot move through it easily. People notice a dull ache on the back of the wrist. That gets worse when they use their hand, especially when lifting or gripping. The wrist may feel stiff, swelling can appear, and the range of motion often reduces. For example, trying to open a jar may feel like the wrist is locked or stuck. Doctors use X-rays, MRI, or CT scans to see the lunate's shape and blood supply. Treatment starts with protecting the wrist, a splint or cast to limit use, and sometimes medicines to reduce pain. If the bone keeps getting worse, surgery may be needed, either removing damaged bone, rebuilding blood flow, or replacing the lunates with a bone graft or artificial material. Picture fixing a cracked tile by either patching it or swapping it with a new one. Because the exact cause is not always clear, complete prevention is hard. But you can lower risk by avoiding repeated heavy wrist use without breaks, using proper technique when playing sports, and protecting the wrist with padded gloves during activities that involve impact. Regular stretching and strengthening exercises keep the wrist flexible and resilient. Recent studies are looking at better ways to restore blood flow, such as microsurgery that connects tiny vessels, vascularized bone grafts, and new synthetic scaffolds that encourage the lunate to heal.